Welcome. I hope most of you have heard my other lectures. I am worried there are not many men though, because atherosclerosis is more common in them. Atherosclerosis, what we do not know. As usually on my lectures, there will be a lot of information. I will try to educate you, debunk some myths, and show you what I think is the truth. Atherosclerosis is one of the diseases of affluence. Other examples are cancer and diabetes. 75% of world population does not know about atherosclerosis. Cardiovascular diseases were the fourth most common cause of death in 1900. A century later, they are by far the most common cause. Moreover, strokes are the third most common death cause. It has all changed throughout the last century. Let's look at the definition. Atherosclerosis is a chronic disease in which degenerative and proliferative changes in the innermost and the middle layers of arteries, especially in the aorta, coronary, cerebral and limb arteries occur. Atherosclerosis is the most common cause of arteriosclerosis. This is what it looks like. Blood should flow through a vessel without any obstacles. If any appear, blood flow is limited. If the obstacle becomes big enough, it can stop blood flow completely. Maybe if I had put stroke, hypertension or cardiac arrest instead of atherosclerosis in the title, maybe more people would have come. People do not make the connection between these disorders. Now some biology. I always say we are subjects to the laws of nature. One of such laws is the Hagen-Poiseuille law, which is described by a very complicated equation. I want to draw your attention to r, which stands for radius. If the diameter is 22 centimeters, the radius is 11 centimeters. In this equation, radius is raised to the fourth power. If vessel's radius is halved, the flow is reduced 16-fold. One half to the power of 4 gives 1/16. Say the blood flow to the brain is 50 milliliters per kilogram per minute. If it is reduced 16-fold, it will be around 3 milliliters per kilogram per minute. That is quite a difference, isn't it? Few people make the connection between atherosclerosis and cardiac arrest. Atherosclerosis can manifest in many ways. In the classification of coronary artery disease, there is a thing called sudden cardiac death. A person is seemingly healthy. They suddenly have a cardiac arrest, which results in death. That is coronary artery disease. 33% of patients die immediately due to a heart attack. The rest are resuscitated. Their blood flow and respiration are restored. However, in some of them, proper cerebral blood flow is not restored. Their heart was unable to maintain blood pressure required for cerebral perfusion to occur. It causes brain damage. Such a patient is admitted to an ICU where they stay for several months. These people are often obese. This is a photo of one of the patients from the hospital where I work. You can see bed sores and fistulae. Like I said, heart attack can result in this and many worse things. Let's move on to stroke, which is caused by a blood clot stopping the blood flow to an area of the brain. Stroke can lead to death, but disability as well. Aortic aneurysms are other signs of atherosclerosis. Due to atherosclerotic changes, a part of the aorta is enlarged. In 33% of patients, aortic rupture occurs. 65% of patients die before the arrival of paramedics. Ulcers are a more common sight. For example, leg ulcers, in which the leg has to be amputated sometimes. All of that is caused by atherosclerosis. We also have intermittent claudication, which is more commonly associated with atherosclerosis. There are several atherosclerosis risk factors that are deemed non-modifiable. One of them is male sex. It means atherosclerosis is more common in men than in women. However, American men die due to cardiovascular diseases 17 times more often than Chinese men. Sex is the same, so there has to be other difference between them. When we do not know who or what to blame, we blame our age. 2 days ago I talked with my neighbor. She said it was all because of her ID number and that an old person simply has to develop atherosclerosis. I do not agree with her and I want to show you some facts. This diagram shows the development of atherosclerotic plaque. On the left we have the first decade. In the middle, the third decade, and the fourth decade is the rightmost one. At the beginning, lipidosis develops. Fat accumulates in arteries. Then atheromatosis occurs, which means that there is a lot of fat under the endothelium. At the end, we have atherosclerosis, rupture, and the development of plaque. Let's look at the first decade. If someone 45 or 50 years old has a heart attack, the process leading to it must have started a lot earlier, as the diagram indicates. That is exactly what happens. Autopsies performed on soldiers who had died during the Korean War found that 77% of them were affected by coronary atherosclerosis. These soldiers were young. Following this study, the prevalence of coronary atherosclerosis in 111 accident victims was analyzed. 86% of them was 26, and none of them was older than 32, so they were young as well. Atherosclerotic changes were found in almost 80% of them. 20% of them had blockage exceeding 50%. Artery blockage higher than 75% was found in 9% of them. Let's move on to another study. Association between cardiovascular disease risk and atherosclerosis in children and young adults was examined. 204 accident victims between 2 and 39 were analyzed. 20% of people between 2 and 15 had atherosclerotic changes in their aorta. It means every fifth child that died in an accident was affected by atherosclerotic changes in their aorta. These were less prevalent in people between 16 and 20. 30% of people from 21 to 25 had signs of atherosclerotic changes. These changes were found in 60% of people over 26. 9% of children between 2 and 15, about 35% of people from 16 to 20, and almost 70% of those older than 26 had atherosclerotic changes in their coronary arteries. They were young, and atherosclerotic changes had already developed in them. We may also want to blame our genes. Studies show that Japanese men that live in California or Hawaii have higher cholesterol levels and are more likely to develop cardiovascular diseases than Japanese men who live in Japan. Can genome change so drastically in 1 or 2 lifetimes? Of course not. Their environment and dietary habits changed. Some more biology. I always say that to defeat an enemy, you have to know them first. Few people know all cells in the body are able to produce cholesterol. All cells produce cholesterol for their own use. 20% of cholesterol is produced by the liver. Intestines, adrenal glands, and reproductive organs also produce it. It is produced from carbohydrates, also known as sugars. The synthesis begins with the binding of 2 acetyl coenzyme A molecules which come from pyruvate, which is made from glucose. You probably did not know about that, did you? Here we have a very complicated diagram which shows the process of cholesterol production. I just want to point out cholesterol is necessary for us. Would cells produce something they do not need? I do not think so. What do we need cholesterol for then? It is a part of every cell membrane. It is a component of pulmonary surfactant. Without it, we would not be able to breathe. Cholesterol is a component of myelin sheath as well. Without it, conduction of signals can be impaired. Multiple sclerosis is a disease of myelin. Moreover, cholesterol protects our skin and promotes the production of serotonin, a hormone that contributes to the feeling of happiness. Cholesterol is a substrate in the production of coenzyme Q, which is a source of energy in the cells. Cholesterol aids in the absorption of vitamins A and E. It is a component of adrenal cortex hormones and sex hormones. Without them, we would not function properly. Cholesterol is a substrate in vitamin D3 synthesis as well. It is also a substrate in the production of bile and bile acids, which play an important role in the digestion of fats. You can see that cholesterol is necessary for us. Some of you may think there is good cholesterol and bad cholesterol. That is what we have been told. It is a myth I want to debunk. First, I will explain some terminology. Lipo stands for fats. Therefore, lipoproteins are proteins that transport fat.
High density z angielskiego to jest duża gęstość, a low density to jest mała gęstość.
Does fat have high or low density? Its density is low. If we compared a kilogram of fat and kilogram of meat, what would take more space? Fat would.
Będzie go więcej w kilogramie, prawda? Czyli on jest rzadszy w upakowaniu. Czyli
LDL is nothing else than a molecule that transports a lot of cholesterol and consists of a lot of fat, so its density is low.
Bardzo dużo tłuszczu, czyli jest rzadka, mówiąc kolokwialnie. Natomiast
HDL is a protein that has little cholesterol and fat, so it is denser.
I ma mało w nim cholesterolu, czyli jest gęsta.
Why are these proteins even needed?
Co są te proteiny?
Chylomicrons transport triglycerides from intestines. Substances absorbed in them are transported by chylomicrons. VLDL transports triglycerides and cholesterol from the liver to the fat cells. LDL is commonly called bad cholesterol, and it is the main agent that transports cholesterol from the liver to the tissues that need it, including endothelium. HDL transports the excess of cholesterol from the tissues to the liver, which disposes of it in the form of bile salts. If someone has high LDL levels, you could say their cells need cholesterol.
Jego komórki jego organizmu potrzebują cholesterolu, tak? Tak możemy powiedzieć?
Here we have a diagram. LDL comes from the liver to the tissues that need cholesterol. Tissues that do not need cholesterol return its excess to the liver in the form of HDL. Is that more comprehensible? One more thing. Very small molecules of HDL can diffuse through vessel walls easily. It is very important.
Cholesterolu, one bardzo łatwo mogą przenikać przez ścianki naczyń. To jest bardzo ważna informacja, bo są malutkie i, mówiąc brzydko, rzadkie.
Cholesterol is excreted from the body in the form of bile salts and acids in stool. 1 gram of cholesterol is excreted daily.
Wydala się dziennie około 1 grama cholesterolu.
If its daily synthesis is higher, which may be caused by a high sugar intake, excessive cholesterol will be accumulated in the body.
Cukierków, słodyczy, ciast. To będzie następować gromadzenie cholesterolu w organizmie.
Another important thing. Bile acid synthesis can be stopped by vitamin C deficiency. So, cholesterol circulates in blood. This is the circulatory system. We have arteries in red and veins in blue.
Tutaj one są namalowane na czerwono, ale również mamy żyły. Tutaj namalowane typowo na niebiesko.
Cholesterol circulates both in arteries and veins.
I w żyłach.
Just to remind you, atherosclerotic changes occur in the innermost and middle artery layers.
Wewnętrznej środkowej błonie tętnic, tak? Czyli
It is as if the levels of cholesterol in blood do not really matter.
ilości krążącego cholesterolu, ale miała większy związek od tego,
What
co się
happens
dzieje
in
w
the
tętnicy.
arteries is more important.
Zgadzamy się?
Do you agree?
Wszystko jasne do tej pory?
Are you following me?
Staram się. I
Let's
teraz
imagine
wyobraźmy
blood
sobie, jak
circulating in the
konkretnie
vessels.
krąży. I
Where is
w
blood
których
flow the
miejscach,
largest?
jeżeli weźmiemy pod uwagę krążenia, to w których miejscach będzie najbardziej burzliwy przepływ? Tam
In
zawsze,
places
gdzie
where
jest
blood
głośne
vessels branch.
stążenie, tak?
So in places like the aortic arch.
Burzy się ta krew, wywiera ciśnienie, tak? Czyli tutaj przy odejściu, przy łuku aorty, przy odejściach tętnic, odgałęzieniach tętnic. I tak jest faktycznie.
Let's talk about atherosclerotic changes location. They occur almost exclusively in the systemic circulation arteries, places where the blood pressure is high, such as the aorta and its branches, as well as where the blood flow is turbulent. It is a proof that cholesterol has more to do with arteries rather than veins. Something in the arteries causes atherosclerotic changes to develop.
Otóż co się dzieje?
Say pressure in the arteries has to be 120, and a moment later it has to be 80. A difference of 40 millimeters of mercury equal to 1 meter of water. Arteries pulsate. If you put a finger on your radial artery, you will feel pulse, an artery contracting and expanding. It happens because artery walls, in contrast to vein walls, contain muscle tissue.
Zawierają bardzo dużo tkanki mięśniowej, w przeciwieństwie do naczyń żylnych.
Moreover, artery walls have a lot of elastic tissue, which allows the arteries to change their shape.
Im na zmianę swego kształtu, na to właśnie tętnienie.
Elastic tissue in arteries is composed of collagen, elastin, and proteoglycans. We all know about collagen and collagen creams, which boost skin elasticity. Few people know about proteoglycans, but they are important because they are a component of joint cartilage. This cartilage is elastic, which allows us to move freely. In 1960, Dr. Kilmer McCulley noticed there are children that die due to cardiovascular diseases and strokes. He observed that they all had high homocysteine levels and they excreted much homocysteine in urine. Moreover, he noticed atherosclerotic plaque in their blood vessels. He could do an autopsy after these people had died. Only then he could analyze their blood vessels. Although he published his studies in many periodicals, nobody seemed to care about his discovery. It was in 1960, 20th century. Nowadays, homocysteine is often called the cholesterol of the 21st century. Homocysteine is a substance which destroys elastic tissue.
Która ma to do siebie, że niszczy elementy elastyczne wszędzie, gdzie je spotka, również w naczyniach. Czyli
there are collagen fibers which are stronger than nylon in the body. Cysteine aids in collagen production, whereas homocysteine inhibits collagen formation. Copper, vitamins C and B6 are necessary for the production of collagen fibers. Elastin works like a rubber. It supports muscles in the arterial walls. Homocysteine degrades elastin structure. Proteoglycans are a component of arterial walls and cartilage. Homocysteine degrades their structure and promotes LDL absorption. What is homocysteine? It is biosynthesized in the body. It is created from proteins. Animal proteins contain a lot of methionine, an amino acid which is rich in sulfur. Methionine is synthesized into homocysteine, which should quickly be transformed into cystathionine, which in turn is changed into cysteine. Vitamins B6, B12 and folic acid take part in this process. Therefore, if someone is deficient in vitamins B6, B12 and folic acid, their homocysteine levels will rise, which will cause the degradation of arterial elastic tissue.
Dojdzie do zwiększenia poziomu homocysteiny i do uszkodzenia struktur elastycznych naczyń. Zgadza się?
Abnormally high homocysteine levels are caused by poor diet, which leads to vitamin deficiency. They are also caused by some chemical substances, such as methotrexate, folic acid antagonist, which is used in cancer and rheumatoid arthritis treatment, or theophylline, vitamin B6 antagonist. Trace amounts of it can be found in tea leaves. Fibrates such as cyprofibrate and metformin, which are used in diabetes treatment, are also linked to high homocysteine. Metformin may cause high homocysteine levels. Other causes include chronic diseases such as chronic kidney disease, leukemia, and so on. Studies suggest that homocysteine level is a very sensitive and specific indicator of cardiovascular diseases risk. It provides 90% accuracy. I kept asking my mother for 3 years to get her homocysteine levels measured. Eventually she did that, and she had high homocysteine levels. Have any of you gotten their homocysteine levels measured? Homocysteine levels influence the risk of heart attack and stroke. A study conducted in Poland shows that 30% of Polish people suffer from hyperhomocysteinemia. Normal levels of homocysteine range from 5 to 15 micromoles per liter, but actually you should have no more than 10 micromoles per liter. In the US, 6.6 micromoles per liter is the norm. Correlation between diet and homocysteine levels was analyzed. Levels of homocysteine, folic acid, and vitamins B6 and B12 were measured in 2,695 young people aged from 15 to 20. The influence of various diets was tested. These were the following: whole grain diet, refined grain diet, so some of them ate products made with white flour, such as pizza, white bread, and so on. Other diets tested were based on fruit, vegetables, dairy products, red meat, processed meat, and poultry. It turned out the group which followed a whole grain diet had the lowest homocysteine levels, because that diet lacks the substrate used in homocysteine production, so small amounts of it were produced. That diet is rich in vitamin B6, so homocysteine could be quickly transformed into cysteine. People who ate poultry had the highest homocysteine levels. I will not comment on these results. Here we have homocysteine biosynthesis once again. Vitamins B6, B12 and folic acid protect the blood vessels from homocysteine.
Ochronie naszych naczyń przed czynnikiem uszkadzającym w postaci
Where can we find vitamin B6? We can find it in cornflakes, rolled oats, liver, English walnuts, lentil, chickpea, buckwheat cassia, fish, bananas and spinach.
Orzechach włoskich, w soczewicy, w ciecierzycy, w kaszy gryczanej, w rybach, bananach, szpinaku. Czyli, proszę Państwa,
So it seems plants are the best source of vitamin B6.
W witaminę B6.
What about folic acid? It is present in leafy greens, green vegetables.
Im bardziej coś jest czerwone, tym więcej ma kwasu foliowego w sobie. Czyli jeszcze
Just to remind you, homocysteine destroys collagen, elastin and proteoglycans, which are the components of arterial elastic tissue.
Jak się to zniszczy? Mamy wąż, przykład takiego węża.
What happens when it is destroyed? Say you have a garden hose, it has to be elastic. Assume you left it outside for winter. It will not be elastic anymore.
Tak, stanie się sztywny. I teraz, kiedy do takiego węża nalejemy wody,
What will happen after you connect such hose to a water source?
Popęka. Dobrze mówię?
It will burst in multiple places.
Tak się dzieje w naszym
The same thing happens in the body. In healthy people, arteries are lined with endothelium.
Nazywa się śródbłonkiem i ona ma być gładka, żeby nic się do niej nie przyklejało.
It is smooth and it prevents anything from sticking to blood vessel walls. But if it breaks, the layer underneath also breaks, and then LDL comes into action.
LDL przechodzi. Bo dlaczego? Cholesterol pełni również w organizmie funkcje naprawcze.
Cholesterol repairs broken artery walls, which are affected by an inflammatory state.
Proces zapalny.
Every study indicates that atherosclerosis is initiated by inflammatory states. There are many studies which prove that. They also show the importance of inflammation in heart failure development. Atherosclerosis leads to heart failure. Nowadays, it is thought that the levels of CRP, which stands for C-reactive protein, are the best indicator of the state of the blood vessels.
Naprawdę do oceny stanu naczyń to jest badanie CRP, czyli białka C-reaktywnego.
In this study, people whose risk of cardiovascular disease was high had CRP levels that exceeded 2.2 milligrams per liter. Therefore, it is not about cholesterol, but homocysteine and CRP.
Tak naprawdę świadczą o procesie, który toczy się w naszych naczyniach.
I want to point out that over 6,000 healthy people between 40 and 79 were analyzed in that study.
Bez wcześniejszej choroby serca, naczyń i cukrzycy w wywiadzie w wieku 40-79 lat, czyli
It lasted 10 years, and it showed that people with high CRP levels are more likely to develop cardiovascular diseases.
Serca i naczyń. Już wiemy, co to jest zapalenie.
Now let's move on to inflammation. When you hurt or cut yourself, there is redness, swelling, pain. Immune cells come into action. You may lose the function in the body part affected by inflammation.
To jest wszystko stan zapalny.
These are the symptoms of inflammation which leads to recovery. It is necessary, but as with everything, it is best in moderation. White blood cells fight foreign bodies such as foreign bacteria proteins, viruses, and mutated body proteins, so cancer cells, for example. These blood cells use free radicals to do it. What are free radicals? They are atoms that lack one electron, and they try to take that electron from other cells. They kill bacteria, but they can also kill body cells.
Też swoje komórki przy okazji, jeżeli toczy się proces przeciwko własnym komórkom organizmu.
Pollution, preservatives, and smoking promote the production of free radicals.
Stosowania konserwantów w wyniku też palenia papierosów.
Just to add to that, I hope there are no smokers.
Wolnych rodników tlenowych. Tutaj nie ma palaczy, mam nadzieję.
There are 100 quadrillion free radicals per gram of cigarette tar and 1 quadrillion of them in cigarette smoke.
Na gram, natomiast w dymie tytoniowym to, co palacz wdycha, to jest 10 do 15.
Quadrillion stands for 10 followed by 15 zeros. In other words, it is 1 trillion millions.
Milionów, tak? Dobrze mówię? Tyle jest wolnych rodników tlenowych.
That is how many free radicals enter your body with each inhalation. This high concentration of free radicals in smoke lasts for 10 minutes. Let's sum up what we have already learned. Firstly, endothelium and elastic tissue are damaged by homocysteine and inflammation develops. Then permeation increases and LDL starts sticking to the damaged arterial walls. LDL oxidizes afterwards due to inflammation and the presence of free radicals. Then monocytes, a type of white blood cells, stick to and migrate through endothelium. They want to consume the cholesterol which is trying to repair the damaged arterial wall. These monocytes then transform into foam cells to which platelets adhere. Platelets are responsible for coagulation, so they form a clot. Is that clear now? Cholesterol is oxidized by free oxygen radicals. This is a picture which shows the migration through endothelium. Free oxygen radicals are destroyed by antioxidants. I'm sorry if you have heard it before, but these substances are involved in many diseases. Antioxidants are electron donors. They can give free radical molecules the lacking electron.
Są to takie cząsteczki, które mają skłonność do oddawania tego brakującego elektronu.
Where can we find antioxidants?
Antyoxydanty znajdziemy gdzie? To już Państwo powinni wiedzieć. Ojej, to naprawdę dobrze, że powtarzam wszystko.
The best source of them are fruits, but why is that so?
Najwięcej ich jest w owocach. Dlaczego?
During photosynthesis, many free electrons are produced, so plants protect themselves by producing antioxidants.
O takie wolne elektrony i rośliny bronią się przed zniszczeniem samych siebie, produkując antyoksydanty. A wiadomo, że słońce najbardziej pada właśnie.
Therefore, fruit are very rich in antioxidants.
Wobec tego najwięcej ich jest w owocach.
The more intense the color of the fruit is, the more antioxidants that fruit contains.
Im bardziej intensywna barwa, tym więcej jest tam antyoksydanów.
So, for example, blueberries, blackberries, strawberries, and so on.
W czarnej jagodzie, też w truskawkach, poziomkach.
The most effective antioxidants are vitamin A in the form of beta-carotene. It can be found in carrots.
W postaci beta-karotenu marchewka jest bardzo pomarańczowa.
Beta-carotene neutralizes free radicals in the cells wherein oxygen concentration is low.
Witamina E reaguje z wolnymi rodnikami.
Vitamin E reacts with free radicals in tissues where oxygen concentration is high. It is fat-soluble as well. Vitamin C works in intracellular and intercellular fluids. These three vitamins complement each other and have the best antioxidative effect when working together. Lutein and anthocyanins found in blackberries are antioxidants as well. The body needs microelements to ensure the proper function of antioxidants. These microelements are zinc, selenium, copper, and manganese. Lutein can be found in green, yellow, and orange vegetables, but also in dark green leafy vegetables.
Gdzie jest maskowana przez zielony barwnik. Również kapusta
Cabbage, broccoli, peas, zucchini, pumpkins, and peppers contain lutein. Copper protects the body from free radicals. It also takes part in connective tissue production, namely collagen and elastin. Copper deficiency leads to the inhibition of collagen and elastin production and the loss of elasticity by the skin. Baker's yeast, sesame seeds, tahini, cocoa, chocolate, dried tomatoes, pumpkin seeds, linseed, wheat bran, dried plums, and peppers are the sources of copper.
Otręby pszenne, suszone śliwki, papryka są źródłem miedzi w pożywieniu. Mangan stanowi tarczę obronną.
Manganese also protects the body from free radicals. It is a component of superoxide dismutase. It helps the brain function and has positive effects on skin and bones. It also prevents osteoporosis and protects from arthritis inflammation. Plant products are the best source of manganese. For example, grain seeds, nuts, almonds, legumes, and tea. Vegan diets are richer in manganese than non-vegan ones. Moreover, very high intake of manganese from organic sources does not cause manganese poisoning. I have mentioned endothelium several times before. It is a very important part of arterial walls. Do you know what sepsis is? Is it contagious? Sepsis is a wrong reaction of the body. It can be caused by injury, flu, appendicitis. It is not contagious. It is a life-threatening condition. Sepsis is an endothelial disease. I tend to talk a lot about sepsis as an anesthesiologist. So endothelium is very important. It produces nitric oxide. What does nitric oxide do? Nobel Prize in 1998 was awarded to Robert Furchgott and his team for studying its function. Nitric oxide relaxes blood vessels, selectively increasing the flow in the vessels where it is necessary. So if a muscle is not used, the blood flow in it is low, but if you started running, it would increase. Nitric oxide maintains the smoothness of arterial smooth muscles, preventing plaque formation. It also regulates blood pressure because it relaxes arterial walls. Nitric oxide is a neuromodulator in the central nervous system and a neurotransmitter in the peripheral nervous system, where it influences digestive tract peristalsis. It helps us digest. Nitric oxide influences the immune system and takes part in the penile erection process, which reminds me that no men have come to this lecture.
Jak już mówię o tym tlenku, to po coś to mówię, prawda? Czyli mamy tutaj zobrazowane. Pod wpływem
The secretion of nitric oxide triggers vasodilation, as seen in this picture.
Do rozszerzenia naczynia. Wszędzie, tam też. Tak? Proszę Państwa,
every study indicates that atherosclerosis is the first phase of endothelial dysfunction. It is the inhibition of endothelial nitric oxide production. It leads to atherosclerosis.
Że nie produkuje wystarczającej ilości tlenku azotu. I zaburzenia, jak tutaj mówię, zaburzenia produkcji tlenku azotu prowadzą do rozwoju miażdżycy. To bardzo skomplikowane.
Now some very complicated things which I will try to explain.
Tlenek azotu.
So we have nitric oxide synthesized by nitric oxide synthetase, which requires oxygen and L-arginine.
Jak to jest?
L-arginine can be produced by the body, but it is also found in food.
To powstaje tlenek azotu. Jest taki
There is this enzyme, ADMA, asymmetric dimethylarginine. It interferes with synthetase production.
ją wyłącza. Kiedy to się dzieje? Kiedy
It happens when the protein intake is high.
Czyli jeżeli w
If someone has a protein-rich diet, ADMA activates and impedes nitric oxide production.
nie pozwala tworzyć się tlenkowi azotu. Unieczynnia ten
Other enzyme, DDAH, which has a very complicated name, inhibits ADMA harmful influence.
żeby nie łamać sobie języka, mówić jak to się nazywa.
However, DDAH is impeded by high levels of homocysteine and blood sugar, infections, and free radicals.
Podwyższony poziom cukru.
This means that high homocysteine levels inhibit nitric oxide production.
Jeżeli mamy duży poziom homocysteiny,
High blood sugar, infections, and free radicals have the same effect.
jeżeli mamy w organizmie wysoki poziom cukru, dojdzie do upośledzenia produkcji azotu, jeżeli mamy infekcję i mamy wolne rodniki tlenowe. I proszę Państwa,
Smoking also influences nitric oxide
na
production.
produkcję tlenku azotu wpływa również palenie
I
papierosów.
was talking about free radicals before. Now I'm talking about nitric oxide synthesis.
Tlenku azotu. 16
Studies indicate that a 16 weeks long exposure to tobacco may cause irreversible damage to the structural and elastic properties of coronary blood vessels.
naczyń wieńcowych, akurat u
This
myszy,
study
ale
focused
tak
on
może
mice,
być,
but the same can happen in humans.
zwierząt. I proszę Państwa, już
Smoking
podawany
a single cigarette greatly decreases the levels of ascorbic acid as well as nitrates and
zmniejszyła
nitrites,
się ilość
from which
azotanów
arginine
do
and
skóry,
nitric oxide are made.
między innymi też ta arginina i tlenek azotu jest tworzony. I
These
zmniejszyło
levels
się
normalized
stężenie
after
kwasu
1 hour.
czyli witaminy C we krwi. Parametry wróciły do poziomu wyjściowych po godzinie od wypalenia jednego papierosa.
However, if someone smokes 12 cigarettes daily, they will take another cigarette in less than an hour, so these levels will remain lower than expected.
Czyli to, co już będzie miało wrócić do normy, znowu zostanie uszkodzone. Czyli
Smoking a single cigarette reduces the concentration of antioxidants, nitrates and nitrites in blood.
Ilość krążących antyoksydantów, azotanów, azotynów i zmiany te
These changes play a role in the contraction of coronary blood vessels, which is common after smoking a cigarette.
Proszę Państwa, za
20% of cardiovascular related deaths are caused by smoking.
odpowiedzialne są papierosy. Taka jest prawda. Jeszcze co
Uric
działa
acid
na
also influences nitric oxide.
kwas moczowy. Taka substancja, która
Uric acid is produced in the body in a very complicated way.
bardziej się robi.
I am trying to make it comprehensible, but there are more processes like that occurring in our bodies, since we are the most advanced living organisms.
I ten kwas moczowy
Uric acid reacts with nitric oxide, producing 6 aminouracil and lowering the concentration of nitric oxide.
ilości tlenku azotu. Poziom
Uric acid levels higher than 6.2 mg per deciliter or 370 micromoles cause gout, kidney stones, as well as cardiovascular and kidney diseases.
chorób sercowo-naczyniowych oraz chorób nerek. I tutaj jeszcze o kwasie moczowym.
In another study, a relationship between high uric acid levels and cardiovascular diseases was confirmed.
Zbadano
Moreover, the correlation between high uric acid levels and mortality was studied.
ryzykiem zgonu.
49,000 patients between 25 and 60 were under observation for almost 5.5 years.
Obserwacja od 1975 roku do 82, czyli 5,4 lata odnotowano
984 patients died during that time.
pacjenci, u których poziom
Patients
kwasu
with uric acid levels exceeding 8.5 mg per deciliter
mieli podniesiony
had higher
ryzyko
all-cause mortality.
ze wszystkich przyczyn. Czyli
Therefore,
wysoki poziom
there is a correlation
cholesterolu,
between
który
high
jest
uric
podwyższony.
acid levels and mortality.
Takie powinny być normy u kobiet.
Women should have between 2.5 to 6 milligrams of uric acid, whereas men between 3.5 and 7 milligrams.
Proszę Państwa, w rozwoju nadciśnienia
Uric acid
również
also
bierze
plays a
udział
role in hypertension development.
kwas moczowy. Teraz wyobraźmy sobie, jak
Hypertension damages
może
blood
wpływać
vessels
nadciśnienie
mechanically.
po prostu mechanicznie, prawda? Mamy uszkodzoną ściankę
High pressure
naczyń,
will cause more damage to the already damaged arterial wall than low pressure.
będzie panowało w systemie wyższe ciśnienie niż niższe ciśnienie. Dobrze mówię? Tak? Czyli według badań,
According to research and common sense, high tension exerted on the myocardial and arterial walls is a damaging factor in people suffering from hypertension. Some studies suggest that hypertension plays a role in vasculitis development. I am talking about hypertension because uric acid promotes its development. What actually is uric acid? It is synthesized from purine bases. The following products are the richest in it: yeast, loin, meat extracts, and sardines. Average amounts of purine can be found in lamb, bacon, veal, game meat, liver, goose, turkey, salmon, mackerel, and trout. Chicken, beef, ham, mushrooms, asparagus, peas, duck, and halibut contain small amounts of purine. Products that contain close to no purine are bread, porridge, flour dishes, milk, cheese, eggs, fats, fruit, nuts, sweets, and mirepoix. In my work, I often encounter people who take Milurit. It is a medicine that lowers uric acid level in blood. I ask why they take it. Some of them answer that they do not know. Some others say the doctor prescribed it, and some say they have high uric acid level in blood. Then I ask them whether they know why they have high uric acid levels and if they know what to do to prevent it.
Kwasu moczowego we krwi i co należy robić, żeby nie mieć podwyższonego poziomu kwasu moczowego? Jaka jest typowa
Their usual answer is that they do not know. Maybe the doctors do not have enough time to explain it to everybody, but the truth is, the more meat in the diet, the higher the purine basis intake, which causes the increase of uric acid concentration, which leads to hypertension, the impediment of nitric oxide production, and atherosclerosis.
Produkcja tlenku azotu i tym samym większe nadciśnienie, większa miażdżyca.
Fructose also influences the level of uric acid in blood, which in turn hampers nitric oxide bioavailability. Nowadays, every foodstuff contains fructose.
Właściwie we wszystkich produktach, jakie się weźmie w supermarkecie, ja zaraz pokażę, okazuje się, że
A study on rats was conducted. It showed that in fructose-fed rats, hyperinsulinemia developed. They also had lower glucose tolerance, higher blood pressure, and higher body mass. Moreover, the production of nitric oxide synthetase in arterial and myocardial endothelium decreased. Therefore, fructose plays a role in atherosclerosis development.
Bierze udział w powstawaniu miażdżycy naczyń, czyli
fructose influences the heart attack, stroke, and aneurysm risks.
Czy w rozwoju tętniaka. Tak, to jest teraz logiczne.
Fructose stimulates the production of advanced glycation end products, age. They are also produced in people suffering from diabetes, whose glucose levels are abnormal.
Wiadomo, że u tych
Their
pacjentów
glycated
bada
hemoglobin
się
level
poziom
is
hemoglobiny
measured. It
glikowanej,
should be
który
lower than
jest
6.
około mniej niż 6. To bada się po
It
to,
is measured
żeby
because red
leczący
blood
pożyje
cells live for about 72 days, and a diabetic must avoid eating sweets for 2-3 days before the measurement.
Jak na 2 dni czy 3 dni przed wizytą, to on unika słodyczy, nie pije słodkich napojów, przychodzi, ma badane
So the doctor measures the level of glycated hemoglobin, and he may say that the patient has had a poor diet, because their level of glycated hemoglobin is 9, but it should be 6.
się odżywiał, bo poziom ma pan 9, a powinien być 6. Dlaczego? Jak jest
When someone has
poziom
abnormally high blood sugar, the body tries to normalize it.
Po pierwsze, eliminacja
The body can
przez nos,
excrete excessive sugar through kidneys.
a jeżeli nie
However,
zmieni,
some glucose will be
wszędzie
pushed
upycha
into hemoglobin
tą
molecules.
glukozę i wpycha ją również, mówiąc kolokwialnie, w cząsteczki hemoglobiny. A ponieważ
As we know,
żyje
red blood cells live for 72 days,
czyli jeżeli
so the measurement of sugar level in blood can be influenced by what someone ate 70 days before.
ta cząsteczka będzie pokazywała, jaki był poziom glukozy 70 dni wcześniej. Tak? To jest jasne teraz? Tak jak mówiłam,
As I have been saying on my other lectures, we function properly thanks to proteins. Actin and myosin allow us to move our muscles. Hormones and enzymes are proteins as well. If a glucose molecule binds with these proteins, their function is impaired.
Przestają spełniać swoje funkcje. One już nie funkcjonują jak powinny funkcjonować. I wobec tego
It causes vascular, renal, and ocular complications of diabetes.
Naczyniowych, do powikłań, do choroby nerek. Cukrzyca uszkadza nerki.
It damages the kidneys and eyes.
Tak? Przy cukrzycy rozwija
Diabetes
się
stimulates atherosclerosis development because of the endothelial damage. The amounts of fructose found in fruit are too small to cause any of the aforementioned complications.
W owocach jest zbyt mała, aby wywołać szkodliwe efekty. A gdzie znajdziemy? To jest
Here we have random fruit-flavored yogurt. It contains glucose-fructose syrup, and it does not matter it is made of wheat. It is made from corn more commonly.
Co w sobie zawiera? Syrop glukozo-fruktozowy z pszenicy, to jest wszystko jedno, skąd on jest. Bo najczęściej jest z kukurydzy, bo jest najtańszy. Tutaj jest z pszenicy, jest to wytłuszczone.
The manufacturer claims it is an upside, but the source of glucose-fructose syrup does not play any role. Here we have a yogurt muesli with cranberries. However, I could not find cranberries in the list of ingredients.
Dlatego jest napisane. I poza wszystkim pozostałym
The important thing is this muesli contains glucose-fructose syrup.
Czy jeżeli muesli jak najbardziej, ale samemu zmieszajmy sobie płatki.
Muesli is good, but make it yourself. Mix oats, raisins and nuts. Way healthier.
Nektar, tak?
This is a nectar. It also contains glucose-fructose syrup. Even juice for children has it. I could go on forever.
Dla dzieci Jupik, syrop glukozowo-fruktozowy. Tych produktów naprawdę jest mnóstwo, które zawierają syrop fruktozowo-glukozowy. Podwyższony poziom glukozy we krwi zmniejsza wytwarzanie tlenku azotu.
Heightened glucose level in blood inhibits nitric oxide synthesis by inhibiting nitric oxide synthase activity.
Polędwica z indykiem.
This is tenderloin with turkey. It contains glucose.
Czyli to nie jest tak, że jak będziemy unikać cukierków,
Avoiding sweets will not make your diet glucose-free.
Żadnej glukozy w pożywieniu. Również tam producent postarał się, żebyśmy mieli.
Glucose can be found in meat as well.
Tu jeszcze raz, że te zaawansowane produkcji
Advanced glycation end products are potential biomarkers for prognosis in the diabetics.
Pacjentów chorujących na cukrzycę. Jeżeli już jesteśmy przy cukrzycy,
Since I have mentioned diabetes, I want to remind you that abdominal fat is a hormonally active tissue. It releases plasminogen activator inhibitor 1, which promotes embolus formation. Emboli and blood clots are a common occurrence in atherosclerosis. Moreover, abdominal fat releases angiotensin II, which heightens blood pressure and damages arterial walls. Abdominal fat produces tumor necrosis factor alpha and interleukin 6, which stimulate inflammation. Therefore, fat accumulation promotes atherosclerosis development because abdominal fat releases inflammatory agents. Abdominal fat releases chimerin as well. It increases insulin resistance and promotes chronic panniculitis. Increased insulin resistance means that insulin, the carrier of glucose, cannot transfer glucose into the cells, so blood sugar rises, which causes vascular damage and age production. Obesity is an independent risk factor for cardiovascular disease, so it is not just smoking that harms you. A 60-year-long observation found that obesity in youth increases the risk of cardiovascular diseases caused by obesity in adulthood. So, if your children are obese, they are more likely to develop cardiovascular diseases such as hyperlipidemia, hypertension, and glucose intolerance.
One oczywiście częściej zdarzają się u otyłych dzieci i u nastolatków.
Some of you may know that not all fats are harmful. They are divided into unsaturated and saturated. The latter are found in animal fats. They are a source of energy and their excess may cause atherosclerosis. Unsaturated fats are divided into polyunsaturated fats and monounsaturated omega-9 fats, such as oleic acid, found in olive oil and colza oil. Polyunsaturated fats have to be present in diet because the body cannot synthesize them. They are divided into omega-3 fats in the form of alpha-linolenic acid and omega-6 in the form of either arachidonic acid or linoleic acid. If they are exposed to high temperature, polyunsaturated fats are transformed into trans fats, such as margarine. They are very harmful. Just to remind you, at the top we have a molecule of a saturated fatty acid. All bonds are saturated with hydrogen, shown as yellow circles. The black ones stand for carbon. A molecule of monounsaturated fatty acid has a single unsaturated bond. Polyunsaturated fatty acid molecule has multiple unsaturated bonds. From alpha-linoleic and linolenic acids, PGE1 and PGE3 are synthesized. They have anti-inflammatory and anti-cancer effect. Moreover, they are anticoagulants. On the other hand, arachidonic acid found in animal meat, dairy products, eggs, and peanuts promotes the production of PGE2, which has an inflammatory effect, and it promotes embolus formation. Nie będę powtarzała tutaj działanie prozapalne i pronowotworowe w przeciwieństwie. Czyli tutaj taka To sum it all up, omega-3 sources are the following: linseed, linseed oil, and saltwater fish. Omega-3 fats have anti-inflammatory effect. They treat inflammation. I always suggest my patients with inflammation take linseed oil or even tastier false flax oil. Omega-6 can be found in meat, dairy products and eggs. They are also necessary because inflammation is a part of the healing process. Omega-3 and omega-6 ratio should be about 1:4. However, many people eat a lot of meat and dairy products, so this ratio in them is close to 1:40, and the omega-6 excess causes inflammation in them. You may think in that case you should just take anti-inflammatory drugs and they will cure atherosclerosis. Sadly, it does not work like that because non-steroidal anti-inflammatory drugs, such as aspirin and ketoprofen, block the synthesis of not only PGE2, but also PGE1 and PGE3. Moreover, these drugs do not inhibit leukotriene production, so inflammation can still develop. Taking these drugs for a long time can also damage the kidneys by causing interstitial nephritis.
Do której może dojść w wyniku długotrwałego stosowania niesterydowych leków przeciwzapalnych.
Trans fatty acids are synthesized from unsaturated fatty acids. During margarine production, chemical solidification takes place. Trans fats are also produced when plant oils are exposed to high temperature while frying or cooking, for example.
Jeszcze raz przypomnę, czyli to wiązanie zostaje wysycone i co robią tłuszcze?
What do trans fats do? Plant oils are healthy in themselves, but solidification changes their properties. Trans fats increase diabetes and cancer risk, weaken the immune system, and cause muscle atrophy. Any trans fat intake is harmful. Do you know that trans fats will have been phased out in the USA by 2018? FDA gave food manufacturers 3 years. Has anybody even heard about it? Trans fatty acids are very harmful to the cardiovascular system. They increase LDL levels. Now we know more about it, and we can deduce that high LDL levels mean tissues need cholesterol because they are affected by inflammation.
Potrzebują cholesterolu, bo tam toczy się jakiś proces, tak? Zapalny. Tak? Teraz patrzymy na cholesterol.
Cholesterol is not the cause, but the effect of atherosclerosis.
Miażdżycy.
Trans fatty acids promote inflammation, damage endothelium, which I have mentioned. They increase coronary artery disease risk and the likelihood of a heart attack. That is what margarine does to you. Now, trans fats are very cheap and convenient because they can be used for a whole day in a restaurant to fry. Trans fat oil will not become rancid.
Na takim utwardzonym tłuszczu, to on będzie cały czas taki sam. On nie zjełczeje.
Trans fats are cheaper and have longer shelf life than butter. They also make potato chips and crackers crunchier and tastier.
I przez dodanie tłuszczyku pozwala zwiększyć walory smakowe tych różnych produktów.
How to avoid trans fats? Look at the packaging. If it says something was hydrogenated, partially hydrogenated, or solidified, it means that this product contains trans fats. Be wary of margarines. Buy organic products. The less processed they are, the better.
Tam producent może włożyć tych kwasów tłuszczowych trans. W restauracji
order roasted or grilled dishes instead of fried ones.
Nigdy smażone.
For dessert, order ice cream or sorbet instead of a piece of cake. Never order fries because they are fried in reused oil. This table is a list of various oils. I want to show you that some of them, such as linseed oil, which has 54 grams of omega-3 and 17 grams of omega-6,
ma aż 54 omega-3, 17 omega-6, czyli ma bardzo dużo omega-3.
Grapeseed oil is usually recommended to use in frying. However, it contains 73 grams of omega-6. I have mentioned that omega-6 fats promote inflammation. Safflower seed oil and corn oil also contain a lot of omega-6. Sunflower seed oil has 69 grams of omega-6 fats. Use other oils to fry. I recommend using colza oil, olive oil, palm oil, coconut oil, and clarified butter. However, Dr. Vogel conducted a study in 1999 wherein he examined the toxicity of some meals. He measured brachial artery diameter in a group of students and then he pumped blood pressure cuffs, causing ischemia in students' arms for 5 minutes. Then he measured how quickly would their vessels return to the initial diameter by using ultrasonography. After that, the students ate a meal. One group was given some fast food meal that had 900 calories and 50 grams of fat. The others were given a meal which also had 900 calories, but no fat. Blood vessels in the second group returned to the initial diameter immediately. In the first group, this process took 6 hours. A single meal causes that. What happens if someone eats 3 fast food meals daily for a year? Are you still surprised that atherosclerosis is so common nowadays? I am not. Alpha-linoleic acid, which can be found in linseed oil, prevents cholesterol levels in blood from increasing. So it has anti-inflammatory effect. It inhibits inflammation. You could say it stops a fire. Therefore, cholesterol is not needed anymore and its concentration decreases. That acid prevents atherosclerotic plaque formation and the deterioration of the health state in diabetics. Therefore, I recommend all diabetics take linseed oil or false flax oil. Just 1 spoonful daily is enough. Heavy metals take part in atherosclerosis development as well. Some of you probably do not understand that because heavy metal is a name of a music genre, hence confusion. These are the sources of heavy metals: smoking, environmental pollution such as fertilizers, sewers, exhaust fumes, and industrial waste. Industrial apparatuses and food additives such as colorings and preservatives are sources of heavy metals as well. Heavy metals are basically everywhere. Exposure to lead and cadmium may promote atherosclerosis. In this research, over 2,000 people were analyzed in years 1999 and 2000. People with increased levels of lead and cadmium were more likely to develop peripheral artery disease. High cadmium levels were caused by smoking. Another study found a relationship between high cadmium levels and coronary artery disease. This study says there is a correlation between smoking and coronary artery disease. Vitamin D3 deficiency increases mortality and the risk of hypertension, diabetes, congestive heart failure, peripheral artery disease, cardiac arrest, and stroke. Vitamin D3 is recommended for atherosclerosis treatment. Get your vitamin D3 levels measured and supplemented. We spend much time indoors. When someone who works gets outdoors, it is 3-4 p.m. when no UVB is emitted and vitamin D synthesis does not occur.
Kiedy nie powstaje z cholesterolu zgromadzonego w skórze witamina D3. Tak jak przypominam z poprzedniego wykładu, że
vitamin D3 concentration of 52 mg per deciliter protects from breast cancer. Vitamin D3 is related to vitamin K2. The latter decreases cholesterol accumulation in the arteries. Vitamin K2 also lowers clot formation tendency by reducing lipid peroxidation, cholesterol levels, and the activity of factor X. Studies show that various forms of vitamin K reverse arterial calcification caused by its antagonists. People who suffer from atrial fibrillation are often prescribed vitamin K antagonists such as warfarin and acenocumarol.
To są antagoniści witaminy K.
Large doses of vitamin K2, also known as menaquinone, may lower coronary artery disease-related mortality. Where can we find vitamin K? It exists in two forms, phylloquinone and menaquinone. The richest sources of the former are kale, spinach, and broccoli, basically leafy greens. Phylloquinone can be synthesized into menaquinone in the intestines by gut flora. Menaquinone is a metabolic product, and the richest source of it is natto. In 100-gram serving of it, there is 998 micrograms of menaquinone. Natto is made from fermented soybeans. I discourage eating unfermented soy foods, but fermented soy is beneficial to health. Cheese is also a good source of vitamin K2.
Ich powstawania brały udział bakterie i dzięki temu mają w sobie dużo witaminy K2.
Stress can cause atherosclerosis as well. I think it is obvious why. The nervous system is divided into somatic, which is controlled by our will and is divided into central and peripheral, and autonomic nervous system, which controls the heartbeat and the function of internal organs. It is independent from our will and can be divided into sympathetic and parasympathetic. Sympathetic nervous system stimulates the body's fight or flight response. It has not changed throughout the years. Imagine a caveman who goes out for a hunt and stumbles upon a bear. This encounter makes cavemen's adrenal glands release adrenaline, which is associated with combat and extreme sports.
Tacy, którzy lubią czuć adrenalinę, tak? Sporty walki, skakanie ze spadochronem, tak? To jest ci ludzie lubią czuć adrenalinę. I ta adrenalina
Adrenaline is released during a fight or a flight.
lub ucieczki.
Adrenaline relaxes blood vessels in the muscles, for muscles are needed both in fights and flights.
Zwiększa się przepływ, bo mięśnie będą potrzebne albo do walki, albo do ucieczki.
It makes pupils dilate to improve sight. Adrenaline makes the skin pale because blood is redirected to the muscles.
Do serca, bo teraz to jest najważniejsze, od tego zależy przeżycie, tak? Jak szybko będzie taki jaskiniowiec uciekać, zależy od tego, czy przeżyje, czy nie.
Say that the caveman successfully kills that bear and eats it. In that case, parasympathetic nervous system comes into action. It is active during the periods of digestion, rest and regeneration. Stress increases blood pressure and heart rate, which make pressure inside blood vessels that were damaged by homocysteine higher.
Jest większy nacisk na naczynia, które mają na przykład uszkodzone przez homocysteinne ścianki, tak? I łatwiej dochodzi do uszkodzenia.
Heart already uses maximum amount of blood from coronary blood vessels, but these vessels are narrowed.
Maksymalną ilość krwi, która dopływa do naczyń wieńcowych. I te naczynia są lekko zwężone, jak to serce.
When heart rate increases, the heart needs more oxygen.
Zapotrzebowanie na tlen.
Every anesthesiologist knows that in order to prevent another heart attack, they have to prevent tachycardia in patients after a heart attack.
Zapotrzebowania na tlen i nie doprowadzić do kolejnego śródoperacyjnego zawału.
Stress promotes blood clotting. During a fight, blood vessels may get damaged. Therefore, the body prepares for such possibility. These things lead to heart attacks, strokes, and atherosclerosis development.
W tworzeniu się zmian miażdżycowych, czyli w rozwoju chorób miażdżycy. I tak faktycznie jest.
There is a study in which 24,767 people from 52 countries were analyzed. 11,000 of them have had a heart attack. The rest formed a control group. Work-related stress, household stress, financial stress, depression, and serious mishaps such as the death of a spouse or a child were evaluated.
I oceniano poważne zdarzenia losowe, takie jak na przykład utratę męża czy żony, utratę dziecka, utratę kogoś bliskiego. Dodatkowo oceniano depresję.
It turned out that people who have had a heart attack were more stressed.
Wszystkich czterech czynników.
23% of them said they experienced work-related stress, whereas only 17.9% of people from control group reported the same. 10% of people after a heart attack suffered from chronic work-related stress. The same was reported by 5% of people from the control group. Less people from that group experienced household stress as well. This study shows that there is a correlation between stressors and the risk of acute myocardial infarction. Neurogenic inflammation is the body's response to mental stress, wherein inflammatory substances are released. We already know atherosclerosis is initiated by inflammation. These substances are released by sympathetic nervous system, which is responsible for the feeling of stress. They initiate the acute phase response. The brain can initiate or inhibit the inflammatory process. Chronic and acute stress can lead to atherosclerosis and inflammatory changes in the organs. Now some words about dealing with stress. It is a subjective reaction to the situation which, according to our judgment, is overwhelming. One of my friends told me an interesting story. A woman who attempted to commit suicide was admitted to an emergency department. She was shouting that we had to save her because she had 3 children. She had 3 children and had taken pills to commit suicide. Sadly, she died. During the period between her having taken the pills and being admitted to the hospital, her perception of her situation changed.
Zmieniło się jej postrzeganie jej stanu. Ona w tym momencie
She changed her mind and she said she did not want to die because she had children. The events that had made her commit suicide suddenly did not matter anymore. Accepting the problem is the first step in overcoming stress. Say you lost your job. If you accept that, it will be easier to deal with this situation. It is better than pretending everything is fine. Learning that your husband has cheated on you or that your child has fallen sick also causes stress. Then you have to look at the problem objectively and stop setting the bar too high. You should also try to imagine the worst-case scenario. Then you will realize there is a way out. There always is. You may be unemployed, but you can find a new job. We are not alone. There are people willing to help you when you need it. Imagining the worst-case scenario alleviates stress. Here is a verse I have recently heard. For every problem we may face on earth, there is a cure, but it may not be there. If a cure exists, then go out and find it, but if it does not, do not think about it. We often exaggerate problems. That is what insurance companies feast on. They often tell you to imagine what will happen to your children when you die. I am married and I have a brother, so I am not worried. Yet they will still nag. Say you are buying home insurance in case of flood, and then they will ask you if you are not scared of a potential burglary. And so it continues.
A można jeszcze na przykład ubezpieczyć się przed zburzeniem budynku, bo spadnie samolot i tak dalej. Naprawdę przed powodzią, przed pożarem i tak dalej. Czyli mamy...
We have a tendency to exaggerate negative possibilities.
Jeszcze bardzo ważne.
One more thing. Some people are like a battering ram. They fight everybody and worry about everything.
Ze wszystkimi. Tak, są takie osoby, pewno takie znacie. I na to tracimy.
This is unnecessary and not worth it.
Niepotrzebnie się nakręcamy, mówiąc kolokwialnie. Jak gdzieś przeczytałam,
I have read somewhere that being angry is wreaking vengeance on your own body for somebody else's stupidity. Who will be harmed by your anger? Not the other person, but your body. Here is a prayer. I have heard it is recited during Alcoholics Anonymous meetings. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference.
I daj mądrość, abym odróżnił jedno od drugiego. Odpuszczajmy w rzeczach.
When a small issue is concerned, let go, but fight for things important to you.
Stańmy na straży rzeczy dla nas ważnych. Czyli takie podsumowanie.
To sum everything up, stress causes atherosclerosis. Homocysteine also causes it. We are surely convinced.
Już wiemy, jesteśmy przekonani co do tego.
High poultry intake causes the increase of homocysteine levels. It can be prevented by eating whole grain bread and leafy vegetables.
Kwas foliowy jest w zielonych warzywach. Inflammation
is promoted by omega-6.
omega-6 powoduje
It
zmiany
also causes
naczynia,
atherosclerotic changes in blood vessels.
Omega-6 występuje
Omega-6 can be found in meat and eggs.
Dobrze. Tlenek azotu działa
Nitric oxide
ochronnie,
protects
to
blood
formula
vessels.
twórczość ochronnie na naczynia, stąd skrzydełka. I teraz do zaburzeń
Its synthesis can be inhibited by ADMA production, which is promoted by high protein
do
intake.
jego produkcji dochodzi wtedy, kiedy jest dużo białka w diecie. Tak? I teraz kwas moczowy
Uric acid is a product of
jest
purine
produktem
decomposition.
rozkładu puryn, a puryny
Purines
występują
can be found in meat.
gdzie najwięcej? W mięsie. Czyli gdyby tak
So
spojrzeć
maybe
na
it is not all about
cholesterol
cholesterol.
może to wcale nie chodzi o cholesterol. Cholesterol
Every
produkują
animal that has a
wszystkie
liver
organizmy
produces it.
zwierzęce. Wszystkie te organizmy, które mają wątrobę, produkują cholesterol. I być
Maybe
może
cholesterol
jest
is just a marker
wspomnianą
which shows how high someone's
wskaźnikiem
animal
spożycia
protein
produktu
intake is.
zwierzęcych. Miarą spożycia białka zwierzęcego, jak również, proszę Państwa, spożywanie białka
What is
roślinnego
more,
wiele
plant
bardziej
proteins
powoduje
lower
wzrost
cholesterol levels
spożycia
more
zwierzęcego.
significantly than limiting fat intake and cholesterol intake.